The aims of our study were, 1, to analyze the relationship between patients' preoperative expectation and postoperative satisfaction as well as functional outcome. 2, to analyze if any of the preoperative parameters can predict patient satisfaction postoperatively. We performed a prospective cohort study where we analyzed 471 patients, that is 595 knees, who completed a 1-year follow-up. All patients were counseled in a standard manner by the senior surgeon. The outcome parameters recorded were the demographics and the new knee society score, that is the NKSS, both preoperatively and postoperatively at 1 year. Statistical analysis was performed using the Pearson's correlation test and a binary logistic regression model. The subjective component of the NKSS has 3 subcomponents, that is the function score, the expectation score, and the satisfaction score. Both the expectation and the satisfaction score have 3 subcomponents each, that is in relation to pain relief, ability to do activities of daily living, and ability to participate in leisure or recreational activities. Both the expectation and the satisfaction score use a Likert scale for scoring. There is no estimated cutoff of classifying patients as dissatisfied. For our analysis, we used Born et al.'s model, who classified responses as of very dissatisfied, dissatisfied, and neutral as patients being dissatisfied. The maximum satisfaction score is of 40 points. Thus, we considered all patients of a satisfaction score of 20 or less as being dissatisfied. The maximum expectation score is that of 15 points. Thus, we considered all patients having an expectation score greater than 9 as having high expectations. The results. There was no significant correlation with of the postoperative satisfaction score with 1, the preoperative expectation score as a whole, 2, higher or lower levels of preoperative expectation score. There was no significant correlation of the functional outcome, that is NKSS and its subcomponents with 1, the preoperative expectation score as a whole, and 2, higher and lower levels of preoperative expectation score. We further performed a binary logistic regression model to predict postoperative satisfaction. Importantly, we found that preoperative expectation of pain relief was an important significant predictor of postoperative satisfaction. Patients with the highest preoperative expectation of pain relief, that is 5 points, had an odds ratio of 1.8 of having a postoperative satisfaction score of 20 or less. In conclusion, a thorough analysis showed no correlation between preoperative expectation and postoperative satisfaction. However, a very important finding was that patients with high expectations of pain relief were almost 2 times more likely to be dissatisfied post-total knee arthroplasty. Preoperative patient expectations do not influence functional outcome after total knee arthroplasty. The clinical significance of our study is that patients' expectation of pain relief is a preoperative, identifiable, and modifiable parameter. Hence, dissatisfaction post-total knee arthroplasty can be reduced by toning down the expectations of those patients that have very high expectation of pain relief preoperatively. Thank you.